Good morning. It is May 21st, 10:11. We are starting the Budget and Public Employees Committee. Madam Clerk, please call roll.
Alderwoman Tyus. Alderwoman Tunye. Alderman Browning. Alderwoman Velasquez. Alderman Devotie. Chair Aldrich.
Aye.
Alderwoman Tyus. Alderwoman Tunye. Alderman Browning. Alderwoman Velasquez. Alderman Devotie. We have one present.
All right. With that, we'll move to approval of the minutes. There is none. Board's bills for review is Board Bill number 1, which is FY 2026 budget for the City of St. Louis. Resolutions, there's none. For committee discussion today, we have corrections, human services, and affordable housing. Starting here a little late. I know some alders will be coming in. We had a press conference with the mayor and elected officials about recently what the storm that has happened. So folks are kind of trailing in, but I want to be respectful of people's time and maybe catch us up a little bit. So I'm going to go ahead and get started. And today we have the Corrections Commissioner, Acting Commissioner, in front of us, as well as his staff. Commissioner, just state your name, and if you want to mention the staff that you have with you, and you can proceed with your budget.
Thank you. Doug Burris, Commissioner, and I have Ms. Bouquet, who's our Budget Director, and we have Ms. Ross, who's Deputy Commissioner.
All right. Thank you. You can proceed.
Thank you. And first I want to start off by saying that I know that with all the damage that was done this past week and that your time is very valuable, so I will not waste it. I will say that the Justice family was harmed in the tornado. We had Ms. Shonda Drones and Marzetta Hamilton, who had serious damage done to their property, and our thoughts and prayers are out with them. As far as the residents of our facility...
I'm sorry, Mr. Burris, could you speak into the mic?
Sure. As far as the residents of our facility, we did get permission to offer 2 free phone calls and a free video visit so they could connect with their family members during this tragic time. Related to the phone calls, I'm very pleased to report that due to a change in law, we were able to lower the price of phone calls that are charged to the detainees from 23 cents a minute down to 7 cents a minute. That was received extremely well by the residents. The facility at 200 South Tucker currently holds about 750 detainees. The majority are awaiting trial and have not been found guilty. That's why I do not refer to them as convicts or inmates. I call them residents or detainees. And in fact, I just went through the entire, what was called an inmate handbook and changed all the wording in that. I have seen cases where people have been charged with a crime and then evidence came out that they were not guilty and released. And so we should respect the Constitution that they are innocent until proven guilty and treat them appropriately. The jail population at 750 right now is an increase of 40% in just 4 years. We're continuing to be around that 750 to 800 number for the most of this year. 1 out of every 4 detainees has been diagnosed with a serious psychiatric illness and are on the appropriate medications. 1 in every 8 detainees are there charged with murder, and 1 in every 12 detainees have been at the facility for more than 2 years. And that is really heartbreaking to see someone locked up in a place who has not been convicted of a crime and has not felt the sun on their face or the hug of a family member for 2 years. We have 1 man that has been there for more than 5 years. Some of the major changes that occurred this year, at the beginning of the year in January, we had 2 programs that we offered the detainees. One was the GED program that was in partnership with St. Louis Public Schools, and the other one is an opiate intervention program that is conducted by the Reverend Burton Barr, who, by the way, has been contacted by CBS out in New York for a possible story on the program. We're very excited about that. But we went from the 2 programs to increasing them substantially. Now we also have an employment preparation program through SLATE, St. Louis Agency Training on Education. And I think this is one of the most important things we do because my favorite saying is nothing stops a bullet like a job. And if we get people the proper training and a good position, they'll likely not return to jail. Our first graduation with this program is this Friday. and then we're going to immediately fill up another class and start again. We're thrilled with our partnership with Slate. We also have a Safe Serve certification program. This was brought about by the National Restaurant Association, and it allows for a certification on proper food handling, and many restaurants require this for upper positions. We've had two classes graduate. We're getting ready for a third. We're very happy with this program as well, and they have an excellent opportunity to gain the experience because just last week alone, we served over 18,000 meals in the jail. We have a veterans program that we started in a partnership with the Veterans Administration, and where they come in to meet with the veterans individually once weekly. Then there's also a mental health part of that that's weekly, and then a spiritual part. When they're released, they help them with all aspects of their life, ranging anything from medication all the way to paying for their college if that's what they want. We also have religious services that are conducted by Elder Bernice Jones and Dr. Kim Gaines, who I believe is very active here on Friday. I also have a program where I write letters to judges on behalf of those who are involved in programming and behaving well. I've written over 75 letters, and I think it is the most enjoyable thing that I do at the jail because I get to brag on people that are really trying to change their lives, and they've also been effective. At a later date, I'd like to show you a video that was done of a man who went to court that was facing 10 years, and the judge cited the letter that I had sent and gave him time served with 3 years of unsupervised probation. So that was a motivator for other people to behave and do well, and for me to write letters about them as well. And I love doing those. We have an English as a second language course program that started again in partnership with the St. Louis Public Schools, and then we have a reading expansion program that was done because of Waller McGuire at the St. Louis Library, where they donated well over 1,000 books. We're able to distribute books again, and we love feeding the minds of people. We also, because of the books they donated, I have seen when children come to visit their loved ones at the jail, they seem really intimidated, and we now have an area with children's books that they can take home with them, and then have a sign up that says free books for children. And that's been very successful. So those are the programs we've implemented since the first of the year, and we're in the coming months, and sometimes in the coming weeks, we're also going to do a mental health restoration program. We'll be the second one in the state of Missouri to that, where the Department of Health, Missouri Department of Health, will hire staff to come into the jail for people that have been found that they haven't been mentally well to go to trial, and they will work with them to establish that. What's great about that is the staff will be paid for by the state of Missouri, and because they are considered patients of their program, they will reimburse the jail $90 a day for each person that they're treating. So we're very excited about that. We also have an honors dorm program where we've met with a group that are designing the rules, and we're in negotiation with them about what we could do, get expanded freedom and other things, and that is very exciting. We have Unlock Labs. This is a program that's in 3 states where they put computers with safeguards into areas where they have education modules that they can get certificates when they're released to help with employment. While they're in 3 states, they're all in prisons. We'll be the first jail in the nation to have this program. And what is fascinating is the co-founder of this organization came about with the idea when he served time at the St. Louis Justice Center. And then we also are bringing forth an opiate addiction treatment program in partnership with Gateway Foundation. We have some other needs that we're looking for help on, and that's domestic violence counseling, doing a victim impact panel with the prosecutor's office, trauma counseling, college courses, and a barber school. Some of the highlights that we've done over the last year is we've increased our communication and partnership with the medical provider. And I know what the reputation was prior to the beginning of this year with the medical provider, and I will tell you that I have been very happy with our partnership with the provider. And the head doctor of their organization, Dr. Maria Dance, she's a Stanford-trained physician who I worked at Barnes for many years. It's fantastic. And my test when it comes to healthcare is, would you feel comfortable if it's your family member being treated by this person? And absolutely, I would with Dr. Dan's. So we've definitely increased the medical services being offered and our partnership with PCUSA. The Department of Health has given us training on various aspects to identify things, and I have to tell you, though, that this is a very sad week for me because Dr. Mahdi will be officially out on Friday, and I think I will go home that day and go into a dark room and cry because she's been so fantastic. We have adored working with her. We've also worked hard to demonstrate our appreciation of staff. In fact, 2 Fridays ago, I personally cooked, barbecued for the entire staff, and I was out there with 3 grills by myself. And when I finished up, a friend came by and said, "You look like you've aged 20 years." And I think next time I'll get partners in helping me cook for the entire staff. But we're also doing other things. We've enhanced our relationship with the Oversight Board, and I know that there were troubles previously, but not only has that relationship improved, but we offer better services because of them. They have given us great insight. And to show you the dedication they have to make the jail better, on Monday, 2 of the members came to the jail who had previously worked at the facility, and they said, "We know that you probably have staff that are out because of the tornado, and we're here to volunteer to work for you today." And I have to say, I have never dreamed it would be that fantastic of a relationship. I thank them so much for the work and suggestions and direction that they offer us. And then another thing that we're very proud of is our biggest adversarial relationship I think that we had was with the Public Defender's Office. And now I think we went from adversarial to excellent. And in fact, I reached out to the head of the organization and said, "Well, 90 days in, what can we be doing better?" And his response was, "You have done plenty." So I'm very excited about that relationship. In the Division of Corrections, going just straight to the budget now, we're requesting $31,883,738. This compares to a budget of $29,800 the year previous. Almost this entire increase is due to the cost of the medical contract going up. Previously, the contract was at $8.5 million. In this coming year, it's going to be $11 million, which is a $2.5 million increase. There have been some reductions. We went from, in the proposal, we're going from 150 positions to 133, and that decision was made because we've just not been able to fill those positions. And I'm going to talk in a minute about strategies to get more staff on. And then educational training services. This one was one that really hit me hard. We went from 30,000 to 10,000. There's a training that's offered by an organization out of Massachusetts that police departments and jails are doing throughout the country, where it teaches people how to communicate better. And instead of, hey, you get in your cell, how to get them in a positive motivation to do so. And we're not going to be able to do that now. And then professional services is the one that probably broke my heart. We requested $765,000, but we're being allotted nothing. And with that, one of the things that we were going to do was provide meals for the correctional staff. And this isn't something that is just an innovative idea. This has been done for decades by some of our competing jails in the area. And we're going to have to get competitive with these jails because we're doing an excellent job right now of training corrections officers who go off to make more money and have better benefits at other jails. And so that's something that I hope to reach towards someday soon, where we can start looking at the salaries of the officers and providing them services and benefits that are more competitive. Going forward, there is a recruitment organization that we hope to be able to utilize called the Walls Group, and I actually used them when I was director of the county jail. And they are able to get mass interviewing taking place where they're very aggressive recruiters, and they do excellent work, and they do it throughout the country. We're also wanting to put an amnesty box into the intake area by the police department. This was an idea that we took from the St. Charles County Jail, where when people are brought into the jail, they're told, we are going to do a strip search on you right now. But before we do that, if you have any contraband on you, there's a box over there you can go drop it off on, and you won't be charged for each box. And that has been extremely successful at the St. Charles County Jail, and has also kept the amount of drugs going into the facility, has reduced that significantly. We want to continue to partner with community organizations. Of all of the programs I told you that we've implemented, we've more than tripled programming. I'm very pleased to report it hasn't cost the jail $1. These are community resources that we're taking advantage of, and they're doing a fantastic job, and we couldn't be successful without them. And we want to continue with that type of work with other community organizations. And then we also want to reach for accreditation by the American Corrections Association so we can adopt national standards and be on the forefront of things that are operating correctly in jails. That's what I had for my presentation, and I hope I didn't rush too fast.
You did an amazing job, and I know some of our folks are still coming, so if we have any additional questions, I will say between you and Ms. Ross and your whole department are very quick to respond back to the Board of Aldermen. I just want to, if we can go back, Madam Clerk, one more slide. Go back again. It's in the drive now? Okay. The new programs that has been implemented, you said it hasn't cost you guys a dime because it's been community resource. Could you talk like a little bit more like how to?
Yeah, I'll go over them individually. The SLATE program is a program that they had previously had in other areas, and it's called Prison to Prosperity. We're having our first graduation Friday at 10 o'clock if you're available, by the way, and we're very excited about that. And they have shared with us that our students are some of the most motivated that they've ever worked with. But SLATE already had funding for that program, so they just brought it to the jail. And they are one of our best partners without any doubt.
Do you think that is that a conversation? I know we have a new SLATE director that program will continue to happen after this graduation for the next participants.
We were told last week, that's a great question, and we were told last week that they're ready to schedule an additional program.
Okay.
So we're assuming that is exactly what's going to happen. The Veterans Program, all of that funding is provided by the Veterans Administration, except for the spiritual part, and that's where we use volunteer pastors to come into the program and participate in that, run programs in that. Same with religious services in that regard. The letter to the judges, of course, the only thing that they cost are the pieces of paper that I use to write the judges. And then English as a second language is through the St. Louis Public School. It's the same instructor, Jeffrey Spinks, who is fantastic, that does the GED instruction. And so St. Louis Public Schools utilizes that. And the reading expansion, Waller McGuire at the library, the head of the library, has basically said anything that they can offer us, they're going to give us because they believe in the work that we're doing.
What's the, I know, pending program, this Unlock Labs?
Right. That is a program that's in states including New York, Massachusetts, in the state prison systems, when I'm referring to these states, including Missouri and in Alaska. And it is they put together programs on educational modules that will give them certificates on anything from coding to other things so they'll have a working skill when they're released from them. And that was, I thank you for bringing that up because that one was brought forth by the Office of Violence Prevention. They were the ones that were able to bring that into the jail, so we're in debt to them for that. Now, some of these programs that are pending that we're probably going to have to look at some funding. For instance, we went to do a barber school.
Yes, I was going to ask about that one. I know, I don't know if you was in St. Louis County at the time when they did the barber school program, but it seems like that's been successful.
Highly successful. And in fact, last week I went in to talk to one of the barbers in one of the pods and told him about how we were trying to get a certification, working towards a certification so he could get a job when he gets out, and he does a fantastic job. My timing was terrible because I had used my father-in-law's barber before I came in, and his first words was, "Man, you should have let me cut your hair." And he was right. So we are excited about that. And the same with the college program, we're hoping to be able to use Pell Grants to pay for the instructors through St. Louis Community College. I've reached out to them for clarification on that. That was one of the programs I started when I was at the county. And I'm so pleased to report that in the history of that program, the collective GPA of the detainees in jail that took the college courses was higher than that of the GPA of the Honor Society on campus at St. Community College. We have so much talent in the jail that is just being wasted, and we do need to be able to take advantage of that tablet so they'll never come back again and provide them the appropriate training. The one thing I didn't really expand on is we've reached out to the Painters Union, and that would be a total win-win situation where they could get a certificate and hopefully employment when they get out. But they have expressed some interest. We haven't gone through the negotiations, but it also gives the opportunity to spruce up the jail, which hasn't been done in many, many years.
Yeah.
So we're very excited about it. Plus, with the tragedy that just we went through as a community this last weekend, I think there's going to be a need for a lot of painters, and I think we'll be able to provide some of those.
These new programs, are all of these programs, they did not exist before your time?
Correct.
Have you seen any, I guess, change in detainees with now having ways that they can be a little productive in the CJC, knowing that, you know, the CJC don't have a place where they can go outside, and they're kind of stuck behind walls 24/7. But have you seen a positive momentum in, I guess, the inmates with these new programs that have been established, and could talk about that a little bit?
I think with the vast majority, absolutely. And that's the thing we probably take the pride in the most, that as a team, we've been able to get people to understand we're there to make them successful. And I'll give you one example of, I have never received so many hugs in a jail as I do now. And it's because when they're completing programming or when they get that letter, I give them a copy of the letter that goes to the judge or various things. It's fantastic. But when we lowered the price of the phone calls from 23 cents to 7 cents, I went to each pod and announced it. And there was cheering and dancing and everything. And one pod we went to, one of the detainees started chanting, "You deserve a raise. You deserve a raise." And pretty soon the entire pod was saying that. It was like Attica, except really good. So we are definitely experiencing some positive feedback. I had one of the guys that started a job in the kitchen, and he came to me and says, "You know, we're talking about you upstairs." And I said, "Oh yeah, what are you saying?" He said, "We love you." But the thing is, I made sure he understood, look, this is a team effort, and we've got some of the team members right here. I may come up with some ideas, but I'm not doing the heavy lifting. We've got some phenomenal staff that are doing a great job.
To dig into the budget a little bit, with the correctional officers, I see it looks like last FY budget you had about 79 filled, and this is always a snapshot, so maybe between the snapshot you hired a few more on. What is, I guess, what is the struggle of being able to get these correctional officers in to be able to work in the CJC?
I think part of the problem is because we are short-staffed and the hiring that we do is somewhat limited, we don't do it in large amounts. We're basically replacing people that are leaving for other jobs that are higher paying and offer additional benefits that we don't offer. That's really the main thing. But if we contract with the Walls Group, this organization that does the correctional recruiting, they have told us they could have 30 people ready for us to interview within a month. And so that's our big hope is we can do something like that, because we also have people that are leaving because they're tired of forced overtime. We don't have enough staff to carry over. We have forced overtime. And there are frustrations that we just need to have more people in so we can do a better job.
The $3 million increase in the healthcare provider from that you actually only requested 8, you requested 8, but you got the 3 million. What is that, like, additional 3?
That was done in negotiations before I came in, and it was signed last year for what the added amount would be for this year. So I'm sorry, I can't answer that adequately.
And I know the CJC probably needs some capital needs. So what are some of the I guess, capital needs that will be completed this year within the budget and what is still outstanding?
That's one thing that we have come up with a list that we're working with the facilities department, but we haven't come up with a plan as far as implementation.
So do you know any ones that will, I guess, until you guys talk with facilities, what will be completed this year? And then,
Yeah, it's the facility. There are repairs that are needed. For instance, in the intake area, we need to be able to build a wall and have a separation between the men and the women. I mean, they're not housed together, but they are in sight of one another, and we want to make sure that doesn't happen. And we also want to, unfortunately, in the intake area, they're locked in an area where they don't have access to a toilet, and we have to let them out to go to the toilet, where we think we can. We've came up with a plan through the facilities department where we can just create a wall where they would have access to the bathroom.
in the intake area, how many, I guess, pods is it in that intake area?
There are two very large ones. I'm probably going to ask for Ms. Ross to help. 9 total.
Okay. So I guess I'm trying to think of, like you say, the men and women aren't separated in the intake. So are they in the same pods sometime, depending on?
Yeah, they're in separate pods, but they're still within. Yeah.
Okay. The holding cells.
Right.
Okay. There was one more. When Dr. Madian, I mean, she extremely is missed. I'm hoping within like 48 hours, she called the mayor, or the mayor called her and say, stay on board because we need her. When she was in front of us, she talked about there was an agreement between your department and her department to pay for medical. And I think it's somehow on her budget side, coming out of like the trust fund instead of coming out of the corrections.
Yeah, I think, and I'll get clarification, but I think that was this fiscal year, but our budget for next year went up significantly. We will cover everything.
Okay. Okay. So that won't be coming out of the health department.
That's, am I right on that?
If you could, may
Stand
need
up
you.
and say your name, please.
Probably got to come up on the mic so the public can hear you. And state your first and last name and your position.
Mignon Frazier Faluke.
Okay, you can get up on the mic.
Of course. Mignon Frazier Faluke, the Fiscal Operations Support Manager. So this fiscal year, we did have to borrow $1 million from the Department of Health based on the updated contract that we signed in February with PCUSA. So we did not have it in our budget to finish out this fiscal year. So next year, we should not have to borrow from them or use their funds in order to pay for the medical.
Okay, got it. One last question for Mr. Burris. I know there's some things you highlighted as far as educational training services, and it clearly sounds like you and your team have been able to implement programs that have been successful, and also the personnel services of a big need. What are I guess, the most critical needs out of this budget that you didn't receive, if it's programming and certain pots of money, or if it's staff? Could you kind of help the budget committee know how we could be a help, if possible, of what those critical needs are?
That is another fantastic question, and without any doubt, it would be personnel. Because we still have occasions where we're not letting out people as much as we would like for recreation and other activities. And if we had the personnel, we'd be able to do that.
You say personnel, more staff?
More staff, yes.
But you are you have those positions open.
Right.
I guess what I'm asking for is, with the more staff, and you kind of talked about the struggle of that, but those positions are already granted. We couldn't try to do an amendment to grant you, I guess we could to grant you more, but it sounds like you need to fill those positions. Is there anything, I guess, lacking in the budget that you requested that you didn't receive that could be helpful?
It may seem like a small thing, but without any doubt, do what the other jails in the area are doing, and that is provide food for the staff, because they have to respond to emergencies quickly, and they, at every other medium to large size jail in the area, they provide meals for the staff, and we're the only one that doesn't.
And that's the personnel services for the $765,000
Yes.
you're talking. All right, that's all the questions I have. Like I say, I know some committee members, there was a emergency that actually happened with an older person I won't discuss, but are on the way. And if we have any other questions, we will email them to you. And thank you for being here. Thank you, Ms. Ross, and thank you, Ms. Fuge? Faluke from the Budget Division. And all, if people haven't seen it, you put out a report when you came in under the previous administration, just talking about your kind of deep dive into the jail, which I haven't seen a detailed report like that. And at my time, I've only been here like 2 years and some months. But really, what I really appreciated about your report, and I think the way that you and your staff have been moving, is to humanize the individuals that are over at the CJC. I think we have to remember these are folks that have not been charged and they are just waiting on due process with the courts. But if folks haven't did some research on your track record, you've been able to turn the county jail around, and hopeful that due to your report and just other services that you're trying to implement can turn the city jail around. Haven't heard any negative things recently, but it's not going to happen overnight. So, Mr. Burris, I'm just glad we got you here in the city. Whatever way I could be a partner. I know we've talked about, coming over there and helping out with some of the programmings and speaking to the inmates. Whatever I could do, you have my full support. And then one last question. How has the timeline been with inmates, which I know this isn't necessarily in your role or responsibility, but inmates receiving a court date to know what their verdict is to be free or not? Have you seen I know COVID had made that process slow, but have you seen a pickup in that far as people getting speedy trial dates to actually get a verdict on their decision of guilty or innocent?
We've seen a minor increase in processing, but it hasn't changed to like it was before.
Gotcha. And I keep saying one last question. This is my last question, I promise. Could you explain to me, understanding that the sheriff has some cells in the jail, how many cells do the sheriff office have, and what are they used for?
I'm going to have to ask for help on that.
I'm not trying to open up no boxes. I know.
Tammy Ross, the sheriff's area has 8 holding cells.
8 holding cells.
From a single cell or a cell that holds maybe 2 or 3 to a holding cell that can hold maybe 20.
And you may talk into the mic. And are those holding cells just when inmates are going over to court that they...
They're staged, yes.
Okay, so you guys house them and feed them and do everything, and when they have a court date, the sheriffs hold them and then escort them.
Right. So
Okay.
they'll order them, we'll stage them, they'll come over, sign them out, and then take them to the sheriff's side if they're not already over there.
And then this is my last question, I promise. When he was here, he talked about their department doing transport.
Mhm.
Has that always been like that? And should that be a sheriff's duty, or is...
As far as I know, and I've been with the division for almost 23 years, the sheriff's department has always done transportation to and from court, anywhere that the detainee needs to go. That has been a responsibility of the sheriff's department. As far as I know, we have only been the holding facility. We house them, provide them the meal and all that. Everything else should be done by the state, which is with the sheriff's department, my understanding.
Okay, and the county, Mr. Burris, when you were there, if an inmate needed to go to the hospital, and I know their municipality is different, was that the correctional facility that transported them, or was that the county PD? And I think they got a sheriff's too, which is...
Yeah, their sheriff's department at the county is very limited. It was the Justice Services that provided it, but there was a line item for that service where we could get equipment, vehicles, things along those lines, where we don't have that in our budget.
Gotcha. Would you guys have the manpower, if I guess that changed, to be able to do the transporting to If an inmate has a situation where they need to go to the hospital where it's not a 911, do you guys have the manpower to do that?
We would have to have significantly more officers than we do now, and more than we requested in the budget next year.
Gotcha. Okay. Thank you, Mr. Barris. Thank you, Ms. Ross.
Thank you.
Thank you. All right, we're catching up a little bit on time. Next, we're going to dive into our next budget item, which we have our director here, Mr. Pearson, from the Department of Human Services. If you want to come on up, state your name and the department you're with, and if you want to inform us of the staff that you have with you.
Sure. Good morning. My name is Adam Pearson. I'm the director of the Department of Human Services. We have a couple of handouts. This is Valerie Russell. She's the deputy director of the Department of Human Services. And then we also have Parimal Mehta, who is our fiscal manager for the department. And could I get the table of organization? Okay.
And the handouts, Madam Clerk, it's just the budget stuff.
Okay. So before I start off, just wanted to publicly recognize you, Alderman, for your work in advocating for the 14th. And I know that you all were heavily affected with the tornado, and I hear that response in that ward has been phenomenal. So thank you for what you're doing. Just have a brief PowerPoint we wanted to go over. First, just kind of introducing the department. For those who may not be fully aware, we have 5 different active divisions. The first is the Youth and Family Division, and I'll talk a little bit about each of these as we move around. But Youth and Family is, these are services that are provided to a diverse population that might be exposed to negative risk factors, including violence, economic deprivation, and family conflict. Primary interventions used to be the delivery of a meals program, but right now we are more so focused on other programs that can uplift families, such as the Housing Eviction Legal Project, and once we get it rolling, the Active Tenants Project. We also have the St. Louis Area Agency on Aging, which is the community's primary community-based resource center for services related to seniors. We have the Office on the Disabled, which acts as the city's ADA coordinator, and also assists with city staff who require accommodations and for the workplace. We have a fiscal division that helps to manage our budget, manage our books, and ensures sound fiscal management with all of our practices. And then we have the Homeless Services Division, which receives federal and local funds in collaboration with the Continuum of Care. And so all of that, we are, you can go, yep, there we go. Just a snapshot of how we administer these divisions. We have around space and RTO for 60 team members. I think presently we are at 49, if I'm not mistaken. We have funding for direct services activities, but also for contract compliance and managing the partnerships and relationships with all of the organizations that we fund to actually execute on the work. Last year, the budget was $50 million, and I've gone through these divisions before, but just some other highlights for the St. Louis area. We have a fairly broad footprint when it comes to senior services in St. Louis. There are around 45,000 seniors over the age of 65. We have contact through our providers with around 7,000 of them. The Office on the Disabled has a number of programs that I can get into in a minute, but the scope of work for that division is fairly broad because they have to think through accessibility for all city-owned properties and be able to prioritize how we're going to make these properties accessible via the transition plan that is enforced by the Department of Justice with the federal government. With the Homeless Services Division, we receive around a little bit over 8 million directly for the COC partners that we do contract compliance for, but the city itself receives, with the latest award, almost 17 million in HUD contracts from the annual award, and then we also receive some planning grants. The Youth and Family Division, back when we were administering meals, we had 62 meal sites that we helped to coordinate back in FY22, and then also the legal assistance program that I had mentioned. And so we can dive into the key performance indicators on the next slide. So SLAY is a pretty, I think it's a sizable team that we have. 6,700 folks have received services through SLAY or one of their contracted partners in FY23. Almost 300,000 have received home-delivered meals, and I think certainly with the storm and the tornado from last Friday, that's one of the big focal points. We're trying to ensure that there's not a gap there, and that one of the big focuses of SLAY has been to pivot towards making sure the affected seniors have access to home-delivered meals. I think yesterday we delivered 2,000 home-delivered meals. Today we are doing 2,000 more in collaboration with some of our partners in the community. We've also had a slightly different focal area with one of our grants, in that there's a number of transportation needs that our seniors have. So we were able to partner with an organization, with a couple of senior centers, to get them electric vehicles. And so for the seniors who had appointments in the community, they were able to utilize the electric vehicles for those appointments. And so not only helping seniors get to where they needed to go, but having a lower environmental footprint for it. You can go to the next slide. Office on the Disabled. There's an extremely close and seamless collaboration with the Board of Public Service with this office, in that we were able to administer 56 encroachment permits, 67 occupancy permits approved based on feedback from accommodations. With our Office on the Disabled, a lot of times we have businesses and housing providers who come in and say, hey, we want to make our facilities more accessible. Could you give us some feedback on how to do it? And so we have a team of experts at the Office on the Disabled who are actually trained in how to assess blueprints and give recommendations on how to make bathrooms more accessible, bedrooms more accessible, office spaces, that sort of thing. We also partner with a sign language interpreter, and so for a lot of the programming that's in the community, if there are public presentations that they do, any presentations with the city or the mayor's office that are to be public, we're able to arrange a sign language interpreter for that. We also did the parking permits for the disability placards in collaboration with the Streets Department. We have a number of reasonable accommodations requests from city employees, and each year we help dozens of folks out to ensure that our city employees have an accessible workplace and are able to complete their tasks. For the Homeless Services Division, like I had mentioned, there is close collaboration with the Continuum of Care. The COC is a consortium of homeless services entities in the city of St. Louis, comprised of service providers, but also advocates, clergy, businesses. It's a wide range of individuals, but the COC designates organizations that they want to receive money from the U.S. Department of Housing and Urban Development. And we are able to apply for that money on behalf of the COC as the collaborative applicant, and then as a project grant recipient, we are the recipients of the money that we then enter into contract with these organizations. We also have an outreach team, so not only do we do the contract compliance and monitoring, but we have a small team of outreach workers who are able to go out to various encampments and touch base with people, figure out what their needs are, whether it's shelter, whether it's mental health services, access to a Medicaid application, et cetera. And so that outreach team hits all of the wards of the city just to make sure we connect with people. We're also partners with House Everyone STL, East West Gateway Council of Governments, Greater St. Louis, Inc., in pushing forward with the regional plan to address homelessness and build some long-term housing in the community. And so we started this process back a couple of years ago. We're still very early on in the stages of this collaboration, but through East West Gateway as the convening body, we're able to partner up with seven counties outside of St. Louis City to work together with elected officials, other COCs, other businesses to think through how we can invest in a regional plan for homelessness. In our system, we have around 700, sorry, I want to stay on the homeless services side again, just because we get a lot of questions about this. A lot of the conversation is about shelter beds in our community. It's one of the things that we support. We have a number of different opportunities for funding, for application for shelter beds and other housing programs. Presently, we have around 700 emergency shelter beds, 96% occupied at any given time. The point in time count this year, as we've seen across the nation, our numbers for unsheltered people have increased dramatically to 387 people versus 154 last year. So there is a need for funding for the Homeless Services Division, making sure that we can get money out into the community to provide services, shelter, and long-term housing for people. Okay, next slide. Youth and Family Program. Last year, we had two programs that we operated, the Summer Food Services Program and the Child and Adult Care Food Program. We are pivoting away from those services because there are a number of providers locally who have taken that mantle up in collaboration with the state and are serving a number of children here in St. Louis, but also we were spending more per meal than we were actually taking in. So the program was actually costing the city money to operate. But when we were operating in FY 2024, we served around 225,000 meals to kids in the St. Louis area. Now the focus is going to be on development of youth empowerment programs. And like I said, we have the housing eviction legal project that we partnered with Legal Services of Eastern Missouri on, as well as the Impacted Tenants Project, which will be collaborating with that office as well. So I think our goals for the next fiscal year, some of these are similar to last year. You can go to the next slide, please. But some of these are similar to last year in that there is a renewed focus on bolstering our contract compliance, making sure that the money we manage in the community is managed effectively, monitoring our subrecipients, just ensuring that the federal money we receive and the city dollars that we receive are spent in accordance with Code of Federal Regulations and ordinance. We want to engage in more affirmative messaging for human services. So talk a little bit more about what we do to the community, advocate for the unhoused population, for seniors, for youth and families, for people who have disabilities. I think there's more messaging that we could do for that. And then continue to collaborate with other departments who we have synergies with, like the Department of Health, Office of Violence Prevention, soon the Building Division with the Impacted Tenants Project. So building some more of those relationships. And then an ongoing need to connect people with the services that they need. All right, next slide. So I don't know exactly how you want to break the discussion down, but I do have a couple of federal concerns we were thinking about, and then we can sort of dive into the line item budget if that's what you want to do. But I think the overall backdrop of where we're at today, and thinking about how we can support the Department of Human Services is the reality that we are facing a federal administration that wants to make a number of cuts. And so we think that that will affect homeless services, senior services primarily. And so I want to talk a little bit about each of these divisions. So the White House Office of Management and Budget proposed cuts to the Office of Community Planning and Development, specifically an 80% reduction in staffing and operational costs. Out of that office is where we have all of the continuum of care money. They also fund housing vouchers for housing authorities, that sort of thing. These cuts, as proposed by the administration, would lead to the merging of the COC money that we receive with the housing opportunities for people with AIDS money that the Department of Health receives, merging those two and then converting it into an emergency solutions grant type program where the focus would just be on emergency shelter and not support with long-term housing. I think the maximum length of time that the federal government indicated that they would want to serve somebody with this money is 2 years. And so this could have some major impacts on how we're actually going to execute housing in the community, what our contracts look like, how much money we receive for homeless services. And then in addition to that, there's a transition away from housing first principles, where housing would have to be paired with some sort of support. And in some cases, that support would have to be provided and received by the client before they actually get housing. So these could have some pretty drastic impacts on the way our service providers are able to receive money and then actually execute on programs. Federal concerns for senior programs, you can go to the next slide. Okay, one more. For senior services, the Administration for Community Living that was operated out of the U.S. Department of Health and Human Services, the Administration for Community Living was charged with administering funds to cities and states for disability programs and senior programs. That organization was dismantled at DHHS, and they moved some of the operations into the the Center for Medicaid and Medicare Services. This includes a complete cut of fall prevention programs for seniors, chronic disease programs for seniors, ombudsman activities, and what that is organizations and people who are able to advocate for seniors in long-term care facilities. And so if we think about the different nursing homes like Northside, for example, that crisis where some of the staff were not getting paid, the staff walked out, the level of care was not what seniors expected in St. Louis. There was an ombudsman stationed on site most of the time to advocate for those needs. And so with the federal government dismantling some of that programming, we are concerned that that could trickle down to state receipt of federal funding, which would then trickle down to the DHS agency on aging. Presently, the city only funds one position with SLAE, and that is the division manager position, but all other staff members are funded federally. And so we're having to think through, if the federal government decides to continue to slash funding for seniors, how do we make sure that those individuals are supported? Going quickly back to homeless services, because I did forget a point. DHS received a fair amount of ARPA funding, I think well over $40 million. The city is losing 200 shelter beds because of a number of ARPA contracts that are expiring. And so we can dive into it in the budget a little bit, but we did request some additional money for emergency shelter beds because some of those contracts are expiring. We want to make sure that we can retain as many of those beds as possible. Okay, next slide. One more. Okay. High-level summary. And so just going, and actually, let me just pause here because really I was going to give a description of what each of our funds are, but I don't know if it would be more helpful for you if we just instead open it up to the line item discussion and then dive in to some of that.
We'll jump into the budget and if I guess folks have some questions on some of these special funds or question pertaining to the special funds can also be uplifted. Do you want me to start, Alderman, or are you settled?
Yeah, we'll cover that. I have a couple questions.
Okay. Alderman Browning.
Thank you, Director Pearson. It's good
Vice
to see
Chair, Alderman Browning.
you. Thank you. Good to see you.
Good to see you.
Even though you come bearing some pretty tough news, and I'm sorry to have been late. It's been a busy morning. You mentioned the cuts from the federal government and this abandonment of the housing first strategy. It seems to me that this is completely the wrong direction to be moving in, that we know what works and we know what gets people both on their feet and stabilized for the future. So if the focus, as you said, is moving more towards more emergency shelter and less towards long-term solutions, do you see that impacting the numbers long-term of people that are unhoused? Because I mean, it strikes me that if we're not finding them long-term housing solutions, they are more likely to end up on the street. Is that something that you're anticipating?
Yes, and so when our teams do outreach at DHS with the Home Services Division, and certainly I think there are a number of organizations in the community who are also finding this with outreach as well. But when we do outreach, let's say we walk up to somebody and say, hey, do you want somewhere to stay for tonight? We have this shelter bed open at such and such shelter. Most of the people we come in contact with, they don't want shelter for a number of different reasons. Maybe they've had a bad experience in shelter, or they don't want to be around 30 or 40 other people that they don't know. Maybe they're concerned that their stuff is going to be stolen, but most people we come in contact don't want shelter. Now, if you ask them, hey, we have an apartment with your name on it, we got to talk to the housing authority, make sure that you sign your lease, that changes the story. Very few people say, oh, no, I don't want my own place to live. And so with the funding shifting towards primarily emergency shelter, I think one of the just supply and demand concerns is that we would be spending more money on a solution that the vast majority of people don't necessarily want. Now, I think that would be the case in warmer weather. I think when it's really cold outside and people are concerned with hypothermia, frostbite, that sort of thing, I think that's when, we definitely would have more uptake with emergency shelters. People want to come inside and get warm. But I think on your average day, people want housing. They want long-term housing. And so I don't know exactly what all of the downrange impacts would be, but what I do know is that right now, people spend a considerable amount in shelter waiting for their name to sort of come up next on the wait list for housing. I think the number from last year was almost 246 days spent in emergency shelter, and that's a really long time. It should be significantly less than that. So if we expand the number of shelter beds but don't expand the number of long-term housing beds, my concern is that we'll just kind of trap people in a system of shelter and not actual recovery.
Thank you for that. I think you said it really well, trapping people in a system of shelter and not long-term recovery. I continue to be just floored by the ineptitude and ignorance of our federal government and the people put in charge. It seemed like we were making a lot of progress under the Biden administration, and now we're not just back to square one. It feels like we're back to the 19th century. So I hope that we can get a change, and that maybe if we're able to collect data, we can make a case for a different approach. I'm curious on the annual operating plan on page 220. The program notes say the program is no longer available under Human Services in FY26. This is the Youth and Family Services Program. Is that because it's moving under a different department, or is it just not something we're offering anymore?
So the Youth and Family Division still exists, but the program offered within that division is going to shift a little bit. I think you might have been absent when I said this, but the Summer Food Services Program, Child and Adult Care Food Program, the amount of money it takes to reimburse for those meals, we were actually paying more. Like the city was actually losing money to administer that program. And then simultaneously, there were a number of other providers in the community who were also applying for those same state funds to administer those programs too. And so there was a significant uptick in the number of providers who were feeding children. They were willing to, continue on the program and take up the families that we used to serve. And so we figured that, if we're going to operate programs within youth and family, pivot towards something that makes a little bit more sense fiscally, but also has the ability to serve entire families. And so I mentioned the Impacted Tenants Fund, and then the Housing Eviction Legal Project that we have with Legal Services of Eastern Missouri. And then certainly with youth and family, we are, with the economic development funds, we're hoping to put out an RFP soon for youth empowerment programming. And so we're still going to be serving families, still going to be serving youth. It just looks a little bit this year.
Okay, thank you. And I do again apologize for being late. We've been very busy in the city since the tornado, so I do appreciate you coming back to that question. Couple more questions, and then I'm eager to hear about the Impacted Tenants Fund and the other things. Line item detail, page 400. It looks like you had two positions that were requested but unfunded: a clerk typist and a client service coordinator 1. Which of those do you think more impactful, more important? And if we could find the funding, would you like to see funded?
Yeah, we would want the client service coordinator funded. Clerk typist would be a position that sits at the front desk in the administrative office, fields calls from the community, greets people at the door. We already have an executive secretary serving at the desk over, and so we have somebody there. But for the client services coordinator, they will be able to meet a number of different needs in the community for outreach. I didn't know if you had anything you wanted to add.
The client service coordinator.
If you could just take your first and last name.
Sorry, Valerie Russell, Deputy Director of the Department of Human Services. Client service coordinator also assists in some other direct services, both within homeless services and in the St. Louis Area Agency on Aging, doing case management and other things that can help that person.
I'm sorry, Ms. Russell, we can barely hear you over here.
You can pull it down.
Thank you.
I need to start over. The client service coordinator can not only assist the Homeless Services Division, but the St. Louis Area Agency on Aging, doing case management and other services for the senior population, actually going in to people's homes. So the client service coordinator position is a more valuable position than the clerk typist, excuse me.
Okay, thank you. That answers my question. Last question is line item detail, page 403. There is money that comes from grants. I'm trying to find, hang on. There's money that comes from grants, and is there ability, to move these grants around to respond with the disaster that happened recently? I'm curious if you have some flexibility in grant money to be able to address emergency needs that come up.
So on page 403, those are primarily dollars associated with the services funded through the St. Louis Area Agency on Aging. The only flexibility is to provide more meals attempt to identify for seniors through the senior centers that are populated and funded. The intake for seniors who may have service needs if they had their own home and are going to be impacted by the disaster. So we are now in conversation with those senior service providers so that they can go out and do the canvassing to determine what seniors have been impacted, and we can make sure that information is provided to FEMA if the declaration is approved and assist them to complete the paperwork, et cetera.
That's very helpful. Thank you. It's good to hear. I know a lot of seniors have been impacted, so it's good to hear that that might be a resource for them and just another way we can help. I really appreciate the work that both of you do, and that's all the questions I have for now.
Thank you, Alderman. Let me know as I wrap up if you have any additional questions. Just to back the bus up, I know you had talked about it, Director, on the youth and family. So that was typically a grant that you all receive. Like you said, you're not going out for it now for as, because we were spending more money. Looks like last year probably got from that grant 1.7 million. Sounds about right. How much, I guess, what was the expense to income? Kind of curious how much were we spending compared to receiving?
Under that dollar amount that you reflected, only one staff person was paid within our office from those dollars. However, the issues related to the imbalance was that the sites that we sponsored, the feeding sites, there were errors that those sites would make in either the serving the meals or documenting the meals served, et cetera. And what that did was caused audit exceptions when the state of Missouri came out to audit the sites in the feeding program. If the sites didn't provide the meal in the proper manner, then the state would disallow the cost for the meal and the city would have to pay for it, but wouldn't be reimbursed. So we made a decision, having seen that pattern over a number of years, that it was not cost effective to continue to serve as a sponsor. And as the director mentioned, in collaboration with the state of Missouri, we learned the number of sites that had come to the table, other partners, other community-based organizations who had also applied to sponsor meals. So we backed away so that we didn't have to pay for meals that we could not find within our own budget.
Yes. Well, I know there's a lot of small groups out there that just focus on the meal feeding, and I think sometimes people forget in human services that there's so many departments, from aging to youth and families to homeless services, that you brought up. So to probably be able to Office of Disability, Disabled, to share the love and maybe let the ones who have the manpower to focus on it is good. Where are we right now? I think the city, and this predates you, Director, when it comes to coordinating with our different unhoused partners, seems like there's so much going on that we're a little slow. And I think this is, probably the best time to start to figure out a winter plan. So have those conversations with the coalition have been happening to kind of get ready for the winter, even though we're in the summer now.
So I want to give a shout out to a lot of the outreach organizations and providers who started with winter discussions for winter of 25-26 this February. And we've had team members who have been able to attend some of those meetings. There have been some feedback that I've been able to give. I think that based on some of the feedback from those meetings, we were able to shape what we needed to for the RFP for the Emergency Solutions Grant. And so we're able to hopefully get some more money out to the community. There's been some ongoing discussion about what winter looks like and how we can better prepare for it. I think one of our big concerns is, we had requested $500,000 additional dollars for emergency shelter for an additional RFP to put out into the community. It's reduced by 250,000. We would love it if we can get the full 500,000 that we requested. I think that could definitely help to meet some of the need in the community. I also know that there are a number of partners who have taken on an extraordinary load in figuring out what they could add as far as capacity, volunteer capacity, staffing capacity. So I think within some of the discussions that have been happening since February, some of the providers getting together to chart the course for what they need to see on a services delivery strategy perspective. And I think with any additional money that we would be receiving outside of ESG, that could certainly help out. And I think that in addition to that, what we're finding presently with this storm is that we do have a large number of individuals who were displaced, who were right in the line of impact of the storm. On our best day, with the point in time count, we had over 300 individuals who were unsheltered. If those individuals who were impacted by the storm don't find shelter and long-term housing, we're going to see more people on the streets. And it won't just be mostly adult men. This will be children. This will be older adults, significant number of people with disabilities. And so I think the storm is going to have a major impact on our shelter utilization moving forward. And that's in addition to the fact that the pop-up shelters that the Red Cross is operating in collaboration with DHS's guidance, those are temporary shelters, right? They're not going to be here forever. And so we want to make sure that we can start to build a little bit more infrastructure when it comes to expanding the number of providers we have for emergency shelter and the quality of the beds that they provide.
Where in the budget, so I'm just, for support, you said you requested 500 and only got 200. Would that be under homeless services? Was that is that a?
1121 or 1110. 1111 and 11.
If you could get into the mic just a little bit, Ms. Russell.
I'm turning pages if you.
No, you're fine. You're doing what you can. 1120
21.
and 1121 is that, speaking of special funds, public safety sales tax 2 fund.
Correct.
And that line item was, so it sounds like did you, I guess, break it up in 2 different funds, which would have got to the 500,000?
It was under one line item, and it was the emergency shelter line item. And again, I'm turning pages if you give me a moment.
Take your time. I'm looking at the 1121 too.
Page 398. Is that what you're looking at? So.
The emergency, okay.
The emergency shelter. So we requested the additional 500,000 there, and they reduced it by 200,000. That additional funds were specifically to be used for an increase in winter shelter beds.
I'm gonna ask Jim a question if that's okay. Jim's our deputy budget director. Just for education purposes, how does this fund work? Is this or is a sales tax fund? So it's, I guess, money that is generated off sales tax?
You're talking about the 1121?
Yes.
Chairman. This is 1121 when this sales tax increase was passed. I believe there was a corresponding increase in the use tax. And then the corresponding increase in the use tax is, for lack of a better term, broken out into different percentages. 10% goes here, 27% goes here, et cetera. I don't have the ordinance in front of me, but the allocation from that additional use tax, or the increase in the use tax, is in this cost center, this 1121 Public Safety Sales Tax Fund. It's just way the ordinance was drafted. It's technically an increase in the use tax, but the funds are collected within the 1121 Public Safety Sales Tax Fund. I believe that's the interplay here.
Could we use general funds to put into the special tax
Like a general fund transfer?
Or, yeah, a removing of money from, I'm just trying to, this could be an off-the-record conversation. I'm just curious, how this fund work if the request was additional 250, how would that work?
So general funds could be used for emergency shelter. We would just put it under an emergency shelter account with those injection of additional general funds, but it would not have to be added under 1121. We could do it as a separate 1010 or 1000 account or fund and use it for emergency shelter. We would just have to go back to the budget division to ask for the additional account.
Gotcha. And while we're on emergency shelters, I know, Director, you talked about the money that we back up a little bit. Whatever way I could be helpful with supporting the plan for coordination for the winter outreach for our unhoused. So I always say probably the most unhoused facilities, shelters, and then we opened up Peter and Paul. I know there was an emergency one that now is shutting down because they got ARPA funds. I think that may be a concern with Peter and Paul also, because I know they had received those ARPA funds. Or is your department, I guess, working with some of those shelters that, receive those ARPA funds to maybe connect them to other groups that could support financially? I think St. Patrick Center is also one of those ones that, I think in the medium term, we thought, ARPA funds, let's use them. But I think some of these facilities did not have a financial plan to figure out how to stay open.
So specifically with the Peter and Paul location, the city, and with the new building that Peter and Paul purchased, assisted in the purchase of that building, as well as provided operating funds for Peter and Paul to run a 100-bed shelter within that facility. That shelter is still operating. Those funds are still available. What closed was a COVID-related shelter that the city provided, and we were leasing space within the building that Peter and Paul now occupies. The initial lease was entered into with the previous owner, and when Peter and Paul purchased that building, we entered into a lease arrangement with Peter and Paul for a finite period of time to continue to use the floors. I believe it was 2nd, 6th, 7th, and 8th floor within that building to keep a shelter operating. Peter and Paul didn't operate that shelter. We had another subcontractor who did, and that was the Magdala Foundation. The dollars that were used for the Magdala Foundation's shelter operation were ARPA funds as well. And when we requested additional funds from the previous administration to keep that shelter operating, funds were not necessarily made available. So we closed the shelter that Magdala Foundation was operating. Every last person that was being sheltered was placed into other housing. There was no one displaced that was under the Magdala Foundation's operation. Peter and Paul lost the funds that we provided for the continued lease of space, but they are still operating a shelter with funds that we have provided to them from ARPA dollars for their own 100-bed shelter.
And maybe I said it wrong on the record. I'm aware they're still operating. I think maybe I'm looking at the Safe Haven shelter. Was that the one during the pandemic, about August 11th, 2024, that is, I think, received the Grace House?
Right, that's St. Patrick's Center.
Okay. And St. Patrick's Center had got COVID money to open that one up, which is now most likely not.
Do you know what the extent of it?
So they were able to take some of the people that they had served at Grace House and serve them in another program. I believe it's the Women's Night program that they have. And so they did lose some beds from the original Grace House. I think they had 25 overnight beds. And I think that has been scaled down a little bit. I don't want to give you the incorrect amount, but they were able to retain some of the individuals from the original Grace House. We extended that contract as far as we could go. There was one point, I believe the contract was set to end in midwinter. I think it was going to be December 2024. I think just operationally, it doesn't work for people who have the highest needs to close a shelter for them on New Year's Eve. And so we worked very hard to allocate as much money as we could to extend that as far as we could.
Gotcha. Just a few more questions. Have there been any outreach? I've received several calls about Cass and right off the highway, the unhoused encampment, in which somebody who's sensitive to our unhoused community, but it's growing. And I know, like you said, Director, some folks don't want to go into shelter. But has there been any from the city, DHS department, trying to work with that unhoused community to kind of move them into shelter? I mean, it's a situation, and I'm not trying to say it in a negative way, but it is a situation that I know that it's private land, Paul McKee's land, so it's not like city land, but is there help to try to move our community members into housing?
Yeah, so anywhere where there's an encampment, it's underneath a bridge or a pallet yard such as that one, we send outreach workers out. We collaborate closely with the Department of Health and their Behavioral Health Bureau. The Office of Violence Prevention has a fantastic team of folks who are doing some behavioral health work, and I know they have that partnership with BHR. We also have contracts with a number of other outreach organizations in the community. And so we are in constant communication about that particular site, ensuring that there are people who swing by who can offer services, referrals as necessary. We, as a group of city departments, discuss that encampment almost each week and what the strategy is for engaging folks. I think, as I had mentioned before, I think people want to find community where it is organically, and it's kind of hard to break that up with outreach workers. We want to make sure that the services that we are offering are helpful, that they are desired, but some people try to find community wherever they can be, whether it's underneath a bridge or in an abandoned building somewhere. So we have been in conversations about that one frequently, and we are in ongoing discussions with a number of different departments and organizations to figure out how we can outreach the best we can.
Gotcha. Impacted Tenants Fund, with the storm, I couldn't think of something that, there's a lot of ways to help, and I think this fund could be one. $160,000 doesn't seem, I know this is a new fund, and you guys are, working through it. I know it's coming out of your department, but is there an organization, if you can, that is doing the work for the Impacted Tenants Fund that
So the Department of Human Services was appropriated $100,000 of ARPA dollars, I believe it was the end of last year, to help facilitate the operation of the impacted tenant funds. And in the ordinance, it specified that the funds that would be used to provide direct assistance to tenants would have to come from funds that would be appropriated by the building division from fines that they collected for the types of building code violations that landlords had. Those dollars were never appropriated. So what you see in the budget is $160,000 for FY26. We had a conversation with the budget division just yesterday because we actually had not paid attention to the fact that we had that $160,000 there. To answer your question, however, we have a contract in place for $100,000 that has not started yet, and the contractor is Employment Connection. We have a process that we've put in place with the building division, Employment Connection, and our office, so that once we had the funds, which now we know we can use for FY26 to give to tenants, that project will start gearing up so that we can make certain that the plan and the protocol that we put in place gets initiated. 160,000 is not a lot. I believe a part of your question was whether or not those funds could be used to assist tenants who were impacted by the storm. There is language in that ordinance that specifies that the individuals, the tenants who are eligible for those dollars are people who are displaced because of the negligence of the landlord to not correct the building code violations. We don't know if the storm impacted tenants is a change of use because it's not related to the landlords doing something incorrectly. So I think that while I agree we need to see if there's a double use, I think the Board of Aldermen may need to take that up to make sure that there is allowable use of those dollars for not just tenants impacted by demolition, code violations and closures, but also those who may be impacted by the storm due to no fault of their own, but also due to no fault of the landlord.
Correct. Thank you for that, and I think that maybe that could be a need to be a fix to the legislation. If that fix were to happen, I'm assuming since the program is already set up, if we fixed it in 4 weeks, these funds would still be in that account where they'll be eligible with now a new use. Is 160,000 enough?
The ordinance indicated that we were to provide tenants with the equivalent amount of funds that they had paid for first month's rent or deposit. First month's rent or deposit is not going to assist anyone long-term. So even if it's used for individuals who are impacted by the storm, currently we could only assist them once they found a new place and they gave us a copy of the lease and we had proof that the dollar amount for the deposit is X number of dollars. No, $160,000 is not going to go very far.
In a perfect world, because you do the numbers, what would you, and I know that moving forward, these are 2 code violations, but what would be a good number that could be helpful, knowing that it won't be 100%, but because there's so many people in need, but a starting rough ball number?
If I could just interject, if there were $1 million. And I'm saying that because we don't yet know how many individuals who are renting have been impacted by the storm. That kind of data is being compiled now as they go out and do intake with properties and if the residents are there. The other side of that, though, sir, is that there are not necessarily enough housing units or rental units available for those individuals who are now being displaced. So we're going to have to look at it under a broad microscope to see what's going to help. If these individuals are moving out of the city, they can still receive the funds. There was nothing in the legislation that said they had to move into another unit in the city. In the ordinance, it also doesn't specify that the dollars provided to those tenants only had to be used for deposits. It could be used for moving expenses or storage or other things. So I think it's broad enough in the current language, but clearly we would have to estimate what that would look like based upon the number of tenants displaced from the storm and what those costs are going to be.
And that broad language is good outside of the one that does not speak on a natural disaster or tornado that probably would need to be.
It would need to be added.
Got it. And if that $1 million was in there and it's not used, if I'm not mistaken, Jim, that money still goes back to the general revenue, so it's not as if it's lost.
The 160,000?
If we were to put $1 million in there and we only use 500,000, it goes back into the general revenue?
It would go back into whatever decision of the board and the mayor and E&A. However, we would have to use a portion of those funds to increase the contract for Employment Connect. Their contract only goes through September of 2026, and they'd have to bring on additional staff not currently budgeted to take on a greater population because they have to review the applications. The building division would have to confirm that the property is not usable any longer. There's a number of steps Employment Connection is going to have to go through to make sure we don't have audit exceptions. But so whatever portion wasn't used for direct money for tenants, we could pivot and make sure Employment Connections contract could be expanded and go beyond September of 2026.
Okay, sound all right?
I'd have to get back to you if there was a general revenue subsidy, whether that would stay within the impacted tenants funds. I just don't know right now. For the revenues generated by those fines, the ordinance dedicates them to the fund. So if the department doesn't expend those, say there's 160,000, say 170,000 comes in through those fines, and the expenditures are only 120,000, that would accrue as a balance there.
And did I hear Ms. Russell right that those fines was not collected last FY?
They weren't appropriated for the current year.
Yes. There's not an appropriation in FY '25 from the impacted tenants fund.
The fines were collected, they just wasn't added into the account?
I can't say whether they were collected. I don't know.
That's a building division probably question?
I'm going to have to I can circle up with the building division because sort of interesting. They collect the fines, Mr. Chairman, but the department really administers the funds and how these funds are distributed. The one wrinkle in all this that I would add is when the board passed the Vacant Building Initiative Fund last session, the two fines that were identified and then the two violations that were identified and then the fines increased and allocated to the new Vacant Building Initiative Fund, those were technically dedicated to the impacted tenants fund.
That's a good,
so
I'm glad you brought that up because I believe, I thought that, and I know you're the sponsor of one of them, I thought that the new fines was not taken away from the impacted tenants funds and it was put in a new pot.
That hasn't taken effect until September 1st.
Yeah, but I think you probably just missed what Jim said that, could you
yes, I don't have the ordinance in front of me, but there was, just say, for example, 10 fines, and they were supposed to go to the impacted tenants fund. The ordinance appears to have taken out 2 fines, increased it to $30,000 and a $500 fine, and then move those to the new Vacant Building Initiative Fund. And you can see the ordinance, it carves out this funding from, fines 1 through 8 go here, these 2 fines are increased, or the fines from these violations go here, these 2 violations, the fines are increased and go to the new Vacant Building Fund.
Okay, and we're getting a little off, but if I'm hearing you right, impacted tenants funds was getting 10 of the fines. If there was 10 fines, they were all going to impacted tenants fund, and then it sounds like from what you're saying, and you guys created that other line item that out of the 10, 2 were separated out that now goes into.
Correct. The Vacant Building Initiative.
The Vacant Building Initiative.
The only other wrinkle I'd add, Mr. Chairman, is in the ordinance of the money that's now in Vacant Building Initiative Fund 2, 50% is allocated to CDA, I believe for a subsidy housing. The language is fairly vague in the ordinance, but it's a subsidy for housing, grants, housing assistance.
Okay.
So it's.
Okay. Ms. Russell, I think that's all the questions I have outside of you. Probably just be getting an email for me to, like you said, I think we need to revisit some of that language and for that. Yes, I'll be sending you an email. For the director, what is, I guess, the most in this budget, the most critical need that you did not receive, if you could make an ask to the budget committee?
Yeah, so I can speak briefly and then I can let Ms. Russell follow up after me because I'll have to head out. We are very, very concerned with ongoing federal appropriations for senior services, especially considering that we only have one staff member with the SLAY team who is paid from general revenue, and everybody else is paid from federal grants.
How many positions are the federal grants?
I want to say 19.
Ooh, okay.
And so I can let Ms. Russell talk a little bit more about that, but just, humbly on record, I want to make sure that we can do what we can as a city to support the operational and programmatic staff at SLAY who are delivering services to the community, helping to fund some of the contracts out there.
Thank you, Adam. In short, the 19 positions that are funded with the federal dollars, our discussions have been with the SLAY director and Adam and myself, whatever the federal funds are that are appropriated for Older Americans Act that come from the federal government to the state of Missouri, and then the state of Missouri divides to send to all of the St. Louis area agencies on aging within the state. We would like to look at those dollars, whatever is appropriated, and to the extent possible, rather than use the money to fund SLAY staff, since we know there's going to be reduction, we would like to have another source to cover at least 12 of those positions with non-federal dollars. The federal funds would still be used to cover those positions that have monitoring and contractual fiscal responsibilities associated with it. But there are 12 positions who are funded with the federal dollars that have direct service roles, as well as working with the senior population and the service providers. Those 12 positions equal close to $635,000. We don't have at this time an identified source to fund those positions, and the General Revenue Fund most likely doesn't have additional dollars to provide to us, even though that would be the preferred method, because then we would know on an annual basis we could continue those services. Those direct services positions include information and referral. We take up to 1,000 calls per month from seniors who need services, and information and referral sends those seniors and connects those seniors to available community. In addition, we have staff who do direct services, education, Medicaid assessments, Medicare assessments, works to help individuals ensure that they get their Social Security benefits, link them to other benefits they may not know of, help them to identify other housing locations that they may be able to afford. So there's a broad level of services that our staff provides. Again, I indicated that there's about $635,000 that would be needed to make sure that those staff members stay in place. While we've not had a conversation with the mayor's office, nor with the fund that I'm about to suggest, the Board of Aldermen a number of years ago, I believe it was in 2016, passed an ordinance to create the senior fund. The senior fund receives about 5 cents on assessed value of $100 assessed value to put money into a fund to create and provide for senior services. The St. Louis Area Agency on Aging, however, is that entity who's recognized by the federal government and the state to receive Older American Act dollars for senior services. I believe the senior services collects through that 5 cents tax under the senior fund close to $3 million a year. If there is a desire, there has been a precedent in past years for funds that have been dedicated under one source to be used to support shortfalls in departments that do those services in addition and always have been. So that is something that we could look at, or the Board of Aldermen could look at, the mayor's office could look at, to approach the senior fund to see if some of those dollars, instead of going to service providers that we already fund and we would like to continue to fund, perhaps be used to support the ongoing services by the staff in the St. Louis Area Agency on Aging.
Thank you. Any other questions? All righty. I want to thank the department for being here and coming today, and appreciate everything. All right, we're going to just take a 10-minute stand at ease break before we dive into our last discussion of the day, which is affordable housing. All right, we are back from our recess, and as we continue with stand at ease, as we are back from the stand at ease, the committee discussion that we are continuing on is affordable housing, and today we have the executive, director or commissioner? Director. We have the director in front of us today, Ms. April Ford Griffin, who is always an honor to have not only in front of this committee, but just do great work for the city of St. Louis. And even though I'm the alderman now on the 14th, I used to say she was my alderwoman of the mighty 5th Ward, so it is it's always surreal, and you've always just been super supportive of me and my family and just done great work for the community and now doing great work for the city, so we are honored to have you within St. Louis. Whenever you're ready, you just state your name, and then you may proceed with your presentation.
Okay. April Ford Griffin, the Executive Director of the City of St. Louis Affordable Housing Commission. And I'm happy to be here, and as I always say, and as you mentioned, Mr. Chairman, I'm proud to have seen you as a young man growing up, seeing me and your mom, the work we were doing, and wanting to continue to serve the public, which is a hard task. So I am happy to be here before you. Our budget is usually, and it is again, pretty straightforward budget. The total amount of the proposed budget is $6,513,175, and I'm getting that straight out of the budget division's budget book before you. The majority of the budget goes to the subsidy housing assistance line item, so my presentation will focus on explaining the use of those funds.
Yes, ma'am.
The total amount in that line item is $5,555,512, with $5 million of the total budget of the 6.5 million, 5 million of what we say new money from the use tax. Last year, we received 6.5 million, and for a couple of years before that, it has been about 6.5 million. So this year, there has been a significant reduction in what we are being proposed to be allocated out of the use tax fund. However, due to our savings in personnel, it has been mentioned last year and at various times that we have a small office. There's 7 permanent positions, and we have had several vacancies for the last 2 or 3 years. So we had a significant savings in personnel, as well as some contracts from last year. After they closed, they had some money that they had not spent in developments that had monies that were recaptured. So between repayments of loans, closeouts of contracts last year, and I added up all the contracts closed this year, plus some interest, that's how we were able to put together the total of 6.5 million, which is great and is greatly needed, because we have contracts with nonprofits who are providing much needed housing services for homeless prevention, for home repair, for utility assistance, for education and counseling. And it's important to be mindful that while we are dealing with what has been a true tragedy in our communities from the tornado last Friday. There are people who must continue to do the work that was currently being done, or else we're going to have a larger problem. So we have nonprofits who are helping to feed and house and repair homes and people out of homelessness and working at that every day. And the more funds we have, the more we can provide. This presentation speaks to starting off with the history that we were established by an ordinance and it was amended. And in that ordinance, it states that we shall receive no less than $5 million each year. This effort that was put together by grassroots organizations and a collaboration built that went out and got thousands of signatures to create an affordable housing trust fund so that in times when the city is at a loss in revenue, there is always an annually renewing source of funds to house people who are poor, to provide services, housing services for people who are poor, to develop housing for people who are in need. This has been very successful according to our history and the latest budget before you. This fund raised $50 million. And it's hard pill to swallow when the Affordable Housing Trust Fund gets 5, when that was the sole purpose of the creation of this use tax. So you will often hear through E&A hearings and public hearings you have here, many of the advocates who are still around today, and they certainly call us, say, hey, why aren't you getting more? And some over the past several years have threatened to even sue the city because, once again, the money goes to plug deficits in some of our other departments when the sole intent when this was created was for the affordable housing and health care for those uninsured and underinsured. So as always, we will do our very best to make a large impact and leverage the funds that are approved here at the board and at E&A. And so I gave you an example of the lowest end of the area median income that we served and the highest end. The lowest is the very low income, 20%, and the highest that we can serve individuals are 80% of the area median income, which you see there for an individual in our city is $14,448 a year, and a family of 4 is $20,640 a year that classify under the 20% AMI, and any range in between there going all the way up to the maximum amount an individual can earn is $57,800 a year to be at the 80% AMI, and a family of 4, $82,550 a year. I think it's important to state that because those are pretty decent incomes when you look at what the average income is in the city of St. Louis, okay? So when we talk about building affordable housing throughout the city and in some upper income neighborhoods, sometimes there's a lot of opposition because people think, oh, you're gonna bring a bunch of homeless people here. That's not the case. As you can see, we do serve people who are homeless oftentimes, but we also serve people who earn up to $57,800 a year. That certainly is not someone who is poor. Those are moderate income. And so affordable housing simply means that you should not be spending more than 30% of your household income on things such as your rent, your mortgage, your utility. And so that's what we try to achieve as we have been authorized and mandated to under the city's ordinance that established our office. And so really, your page 3 goes to talk about our mission and how we're going to use those dollars. And so we operate as funders. And so we have an annual funding round that's competitive. We take in applications and we make decisions through our board. I did not say that we have a commission which is made up of 11 board members who are diverse by the ordinance. It establishes the various areas in society and our communities that they must have expertise in, such as a resident who lives in public housing, an advocate for senior citizens, an advocate for people with disabilities, person in the financial institution. You have also a person, at several people at large, but then also someone that is real estate agent, someone that does housing development, so that we can hear from a wide spectrum of needs and how to bring this. The affordable housing programs are also designed to ease the suffering and prevent homelessness by individuals and families helping them remain living in their home when emergencies happen. Every year, trust fund dollars help scores of families pay for emergency home repairs, rent, mortgage, utilities, legal representation, tenant and landlord mediation, and other housing expenses when money for housing runs short. Services to help people live productive lives with mental illness, recover from chemical dependency, and or to help men and women transition back into society after being incarcerated. State-of-the-art homeless services and traditional housing programs to help people move from crisis to safe, permanent housing where they can become resilient, self-reliant, and productive. I'll go on to page 4, Mr. Chairman. As I mentioned, the commission opens a competitive funding round every year, soliciting proposals from St. Louis nonprofits, faith-based organizations and agencies, housing organizations, and developers who are solving affordable housing problems in the city of St. Louis. The commission awards roughly $5 million annually, depending on the budget. AHC has awarded over $150.7 million since it was created in 2001. And you have a chart there that just kind of shows you the levels each year. There was a spike you'll see in the fiscal year 2024 and even 23 and 22, and that had to do with us receiving some ARPA funds and some with the ARPA funds early on, and then another tranche of the ARPA funds. On to the next page, the commission receives 80 to 90 proposals for each funding round. Approximately 1/3 of the dollars have been invested in expanding St. Louis's affordable housing stock, and 2/3 of the funding has been invested in affordable housing programs and services. And then it lists some of those type of services that I named before. But I did want to let you know that in the fiscal year 2025, the Affordable Housing Commission received 94 funding applications, and we were unable to fund all of the high-quality proposals due to funding that was available. And this gives you the amount so that you can have an idea of what we receive for grants and developments, the amount of requests that came in. Just for example, in grants was $10.7 million. The amount we were able to fund was $4.7. The total program costs were $56.8 million. And with housing developments, we received $16.3 million worth of requests. We were able to fund $2 million, and the total project cost for what was proposed was $322 million. In the FY 2025 fiscal year, 96.6% of the Affordable Housing Commission's budget went directly into investing it through the funding round to housing services and affordable housing programs. Last year, we invested, well, it wasn't last year, it was the funding round happened September, fall of 2024. The award decisions came out in January. We awarded $4.7 million worth of programs and services that was carried out and continuing to be carried out by 37 nonprofit agencies, many of which are homeless service providers and 4 affordable housing developers. We also invested $2 million in the construction of 88 mixed-income affordable homes. 88 rental homes were created and 0 for-sale homes were created, and that's because we didn't receive any proposals in the fall of 2024 for for-sale housing. All of the proposals we received were for rental housing. The trust fund assisted developments will create a total of 238 mixed income housing units. On your next page, on page 7, you have 2 pie charts that give you an idea of the number of units that we have assisted and created or preserved and for sale compared to rental. The trust fund has created 2,728 affordable housing units in the city of St. Louis since 2003. 2,493 are rental homes and 235 are single-family for-sale homes. On the next page, page 8, it lets you know some of our cumulative data that to date, the trust fund has invested $150.7 million into the city of St. Louis, expanding the supply of affordable housing and supporting programs and services that reinforce human capital, strengthen families and neighborhoods, and improve housing stability. And you have a list there of the different categories of services that we award to. On page 9, it makes you aware that some people are more vulnerable to city housing instability than others, and the housing instability disproportionately affects renters, people of color, people with disabilities, seniors, low-income families with children, and households with lower levels of educational attainment. Close to 19.8% of the population in the city of St. Louis lives in poverty. This compares to the national average of 11.1. So you can see we exceed the national average. Also, when we go to the next page, on page 10, once again, it lets you know what we look at as housing stability. Housing stability is affected by limited supply of available affordable homes, changes in the housing market, increasing the renter population and reducing home ownership, shifting economic dynamics of rising housing costs while wages remain flat. Also, the percent of population that is low income or living in poverty, the growing number of cost-burdened households, and redlining and discriminatory housing practices all affect housing stability. Housing stability is measured by home ownership rate, housing cost burden, eviction rate, and number of homeless. For the last 2 decades, the price for housing has increased faster than income growth. This is true for renters and homeowners. When the cost of housing exceeds 30% of a family's income, painful cuts have to be made. Families often cut back on groceries and make sacrifices on healthcare, education, and transportation. Life suffers. Housing cost burdens make it more difficult for people of modest means to accumulate emergency savings. Prolonged housing instability hurts families and society. As countless households lose their economic footing, they become increasingly at risk of eviction and homelessness. We all have a stake in solving the affordable housing crisis. I would just like to further update on the vacancies that I mentioned. And last year, we had a larger amount of vacancies. As I said, we have a small office. Historically, it's only been 5 of us to do all that you heard about. But 2 years ago, under the previous administration, we increased it to 7, but we still had to fill those positions. So right now, we have 3 vacancies at this time. I am utilizing a temp accountant through a temp service. And so we are, marching full steam ahead and keeping things going and keeping the nonprofits getting paid. I currently have had my staff to send out a survey. They sent that out Monday, trying to assess on the developments that we're funding with ARPA funds, as well as trust fund dollars, to find out which ones, if any, were impacted by the tornado. And so I know just from knowing where many of them are, they were not, but some could be. And we're doing the same with the services, because what very well could happen, any of those projects, especially on a deadline with the U.S. Treasury to have the money actually dispersed by a certain time frame in 2026, as you know, if they are delayed or stalled, you potentially could end up not having dispersed those funds. I don't believe that will be the case, but that's always a possibility. But for us, all of our developments have received 50% of their funding. Some of them have even received 100%. But I do want to add a note that when you get reports from the comptroller's office, when you ask how much of the ARPA funds have been spent, it is only in the accounting system. They only designate it when they give you a report as having been spent if we have submitted the actual receipts. After we have analyzed them, which takes time, then we have liquidated the advance that was given. So it reflects that there's monies that haven't been spent when actually those monies aren't still sitting in the city's bank account, because we have paid the money out and we are continuing to get receipts that then staff has to analyze, and we actually use title companies as a safety measure as well, trying to make sure that it's been verified that contractors have been paid before we disperse funds. And we've had another set of eyes to look at all the receipts and the budget before they disperse the funds. So that takes a little time, but I can assure you that for all of our projects and ARPA projects, the funds that have been dispersed are far greater than what's reflected on the city's ARPA tracking dashboard, I think it is. So I get questions sometimes from aldermen and others about that. So I just wanted to note that. And with that, I will stop, Mr. Chairman, to take any questions.
Gotcha. Also, I want to make note for committee members in the drive. I know sometimes we get them a beautiful in-person document, but you do a annual report that you provided to us for the 2024 report of the community, which for all members is in the drive to also talk about. Oh, there we go.
I sent it to, yes, because we are governed to be transparent and we've been showing, since we've been established, show who we funded. So you'll see a page that shows you everyone who received funds, what the amount is, how many people they are projected to serve, what the name of the agencies and the program is.
Yep.
And
It's
then highlighted some of the before and after construction projects.
very detailed. I just want to make sure that committee members know that that's also in the drive where you can kind of dig deep into some of the projects throughout some of our awards that are happening. So with that, I will turn it over to Vice Chair Browning.
Thank you. I actually don't have a question for you. You had a very thorough presentation, and I appreciate that you're doing well at your commitment to transparency, and I really appreciate all the work that you do over at the Affordable Housing Commission. I think it's important to make sure that we continue to provide for people. As you said, affordable housing is about making sure that the burden on people is not more than their a certain percentage of their income, and that means different levels of housing available for different people with different needs. And I continue to emphasize that to people that when we talk about housing and affordable housing, it is a supply issue, and it is about making sure that we have levels available at different levels of income so that people can find the housing that fits their needs and their lifestyles. And that's not true of everyone. You know, some people need 3 bedrooms. Some people don't need any bedrooms. It just depends on what their needs are. So I'm very deeply appreciative of your work. I think I just see good progress every year from you, and I just want to express that gratitude.
Thank you so much. And I thank you also for supporting us with the bills that were passed for ARPA funds, because it's made a big impact. The increase of the cost of materials has gone up. You know, I want to say double, but sometimes it's more than that. And what happens, the developers come back. They have to come back sometimes to ask for more funds, because from the time that the funds are awarded to when they're actually able and ready to put the shovel in the ground, the bids are very different. And that's another reason why we are surveying right now to find out which developments were impacted, because they're probably going to be needing additional funds. I did have a call this morning from one of the developers asking about additional funds, not for the work they're currently doing, but they have vacant units that people have been calling them, that they can get the people who need housing right now affected by the tornado. They could quickly turn over, but they need funds to do that. So they were just checking with us. And, you know, of course, I told them that's always in the forefront. I know the mayor and her team are having discussions about where money can come from for immediate housing. So we're just all waiting, you know, I'll wait to see if we get some other funds. We can certainly quickly get them dispersed by amending existing contracts, which is what we did when COVID first hit. The fastest way to get funds and help out to the residents is amend the existing contracts with additional funds and be clear on the scope of services to happen with those funds. And we're certainly able to do that. One great thing about the Affordable Housing Commission, the funds that come through the use tax funds are not HUD funds. They don't have those regulations attached, and you can move with them. What you can do is greater, allows more flexibility. Of course, we still have to go through the same city processes to keep us all legal, accountable, you know, make sure everything is in good standing.
I also don't have any questions, Ms. April. I just want to, Ms. Ford Griffin, also just thank you for the work that you do and the partnership that you have created. When you look in the report, you know, it's not just about building homes. I know you work very closely with like Employment Connections and different Better Family Life and different agencies, understanding that we can't do it all on our own, and the homeless funds that you guys provide to providers also to make sure that we are housing people who may not be ready right now to go into housing, but working to get there is just crucial. And again, would tell everyone to go and check out the annual review. I'm really excited that you guys are able to help with the Elliott Place, which is Doorways, kind of second phase that helps individuals who have HIV to be able to get housing and medicine, and just a beautiful campus. I've been able to tour some of those homes, as well as preservation, that I know was funds also went to that preservation for kind of another phase. But when you look at these homes, like you say, they may be affordable, but they are, I went into the preservation home and the washer and dryer was bigger than one that I live in, and I pay the market rate. But these are, it's important to also make sure that when we're creating this home and these homes, and I know your department works to ensure that they are not just, you know, some little box homes, that they are homes that have quality, and that individuals living there feel respectable for living in these properties. So you've been doing this work for a long time, even from the old Murphy Park phases of housing. So just thank you, and I know your office is small and mighty, and whatever way we could be a help from the Board of Aldermen, please let us know.
We do what we can. I appreciate both of your comments, and that is so important what you said about the not just housing, on the services. We can put up the brick and mortar, but it will quickly be destroyed if you don't change people's mindset and mentality and teach people the importance of valuing themselves, their community, each other. And that's why we were commissioned with also the service side of providing services to sufficiency and stabilizing neighborhoods. So once again, people have layered issues. It's not just we need more houses. We want them to be able to sustain themselves in that house, or they will be back homeless. And so it's all important work, but it couldn't be done if it wasn't for the nonprofits. They're out here, they're the boots on the ground. So we try to listen to them, and also even in our contracts, survey, and they tell us what's the greatest challenges, obstacles. And as we monitor their programs with quarterly reports, they also submit information like that. So once again, we need the support of the board and ENA, and we're just thankful that the city has made affordable housing a priority.
Thank you, thank you. Seeing no other questions, any acknowledgement of written testimony, Madam Clerk?
We have none.
Any announcements? We do not have a budget committee meeting tomorrow because we have a full Board of Aldermen meeting at 10 o'clock. I will go to Alderman Browning. Okay, I thought you grabbed the mic as you had an announcement. I want to make note that, Madam Clerk, I'm excusing the Alderwoman from the 6th, the 7th, and the Alderman from the 5th, and not the Alderwoman from the 12th. I would take a motion to adjourn.
So moved.
Second, all in favor, aye.
Aye.
Opposed? Motion carries.